Hi there, science fans. Welcome to another episode of Science and Other Stuff for Senior Citizens. My name is Dan Casciano. If you like these COVID-19 videos, please subscribe to my channel and ring the bell to be informed of future videos. In today's short video, I will be describing some of the recent advances to the Moderna and Pfizer vaccines developed to eliminate COVID-19. This presentation includes the dates of FDA emergency use authorization and the CDC Advisory Panel's recommendation for the COVID-19 vaccine priority groups. This slide indicates the vaccines receiving FDA emergency use in the United States. The Pfizer-BioNTech vaccine was approved by the FDA during the week of December 7, 2020, and the first injections into humans occurred on December 14, 2020. The Moderna vaccine, developed in collaboration with the National Institutes of Health, was provided FDA emergency use during the week of December 14, 2020, and was first injected into humans on December 21, 2020. This slide provides some information on three current vaccines that are either approved for emergency use in humans or are very close to achieving that goal. The Oxford University AstraZeneca vaccine is near approval, and it and the Johnson & Johnson vaccines will be described in detail in my next COVID-19 YouTube video. Both the Moderna and Pfizer vaccines are messenger RNA vaccines requiring 2 doses to be fully active. Both are extremely effective, having achieved an effectiveness of 95%. There is a significant difference between the two regarding storage of the vaccine. The Pfizer vaccine requires storage at -70 degrees Celsius, while the Moderna vaccine achieves stability at -20 degrees C. This latter property provides significant transportation advantages. Moderna also has another advantage of recruiting many more vaccine candidates in the 65-year and older groups. This vaccine generated a similar antibody response in this age group as it did in the younger age group candidates. This slide indicates in a simplified fashion how the RNA vaccine works. The structure of the SARS-CoV-2 virus is shown in the left diagram labeled A. The outer coat of the virus is studded with a spike protein that is the means by which the virus gains entry into a host or human cell and initiates an infection. The spike protein also is the structure that our immune system recognizes as part of the invading foreign virus and attempts to eliminate it from our body by forming antibodies against it. The RNA is the genetic material of the virus and contains the instructions or blueprint for making viral proteins. The diagram on the right shows how the RNA vaccine works. The vaccine contains a piece of the viral RNA genetic code that has the instructions to make only the spike protein. This piece of RNA is a messenger RNA and is not the entire structural molecule of the virus and therefore not infectious. Only the mRNA vaccine enters the host or human cell. It instructs the cell's protein synthesizing machinery to make a lot of the spike protein. This spike protein is also made by the immune cells that produce antibodies to the spike protein and proceeds to neutralize the SARS-CoV-2 virus, as well as activating the T cells that then kill cells already infected by the virus. Part of this immune process results in the development of T memory cells that prevents new infections by the SARS-CoV-2 virus. I included this information in the presentation to inform those individuals who may not take the vaccine because of their concern that it was made with blood or blood products, or if the concern is the vaccine is made with aborted human fetal cells or fetal stem cells. These individuals should take the vaccine because the only ingredients are depicted in this slide. The vaccine contains some basic salts for the maintenance of the mRNA structure, an oil or lipid that surrounds the mRNA molecule to aid in entry of the RNA into the host or human cell, as well as protection of this instructional molecule. Sucrose, which is a table sugar, is there to maintain stability of the RNA in the frozen state. And then there is the mRNA itself. This slide describes the recommended schedule for vaccinating the U.S. population. The initial group of individuals who will receive the vaccine include healthcare workers and residents and staffs of nursing homes. The second priority group includes adults 75 and over and frontline essential workers. The third priority group includes adults 65 to 74 years old, people 16 to 65 years old with high-risk medical conditions, and essential workers not included in Phase 1B. After the completion of these priority groups, the remainder of our population will receive the vaccine. The Advisory Committee defined frontline essential workers as first responders, teachers, and other education workers, including daycare workers, food and agricultural workers, correctional facility staff, postal workers, public transit workers, and people who work in manufactories and in grocery stores. Phase 1 of the vaccination effort includes offering vaccine to around 24 million people. In Phase 1B, around 49 million people will be eligible to receive vaccine. Phase 1C is a much larger group, including roughly 129 million people. Although a vaccine is on the way, we must continue to clean or wash our hands often, avoid close contact with sick people, practice distancing 6 to 10 feet, avoid indoor and outdoor crowds, and wear a mask properly. For more information about science, visit my website at www.dcasciano.com. If you have any questions or would like me to develop a video on a specific science subject, leave them in the comments section below or email me at dan@dcasciano.com. Be sure to like this video and subscribe to my channel and ring the bell so you can be informed when I upload a new video. Thank you for watching Science and Other Stuff for Senior Citizens. Bye.